And Michael Tanner is with us, senior fellow at the Cato Institute, co-author of Healthy Competition, What's Holding Back Healthcare and How to Free It, cato.org, of course, the website for the Cato Institute. And Michael, here's my argument in a nutshell, and have at it, please.
Sure.
One of the main reasons that we founded this country, or that the founders of this country founded this country, was to distribute risk. One of the reasons why the federal government was created was to distribute risk. It's the reason why we have the Army, why everybody agrees the Army should be federally paid for, because none of us can afford to protect ourselves individually against an invasion from Canada or Russia or whatever. It's one of the reasons why we have gone now, since Ben Franklin, by and large, organized the fire department in Philadelphia as a public entity, to fire departments. Prior to the Chicago fire, by the way, and Mrs. O'Leary and her cow, whether it's apocryphal or not, you had private fire departments in Chicago who competed, and very often people would simply, if you didn't have a medallion in your house, they would simply drive on by if you weren't paying them the monthly fee. And after that Chicago fire, they said, screw it, we're going with a socialized fire department. We're going to distribute the risk absolutely as widely as possible. Government distributes risk at a relatively low cost. The cost of Medicare is under 2%. Most national health care programs around the world operate at under 3%. The health insurance companies are running anywhere from 15 to 40% in their overhead costs, which goes into profits and whatnot. And, I was arguing the morality of that to begin with, but this is just the practicality of it. If we agree that our bodies being on fire, metaphorically, which would be like getting cancer or a heart attack, if we agree that our bodies being on fire should be put out, that fire should be put out by as broadly a shared risk as possible, then why would we want to have socialized fire departments but privatized health care? It seems to me like we're backwards. It seems to me that and a socialized army, for that matter, socialist army. It seems like this would be one of the very most important things, to distribute the risk as widely as possible, which means everybody in the country participates, which is called single-payer health care.
Well, I actually believe single-payer health care is a coherent system, unlike the sort of hybrids that we have today or the ones that the Obama administration is trying to put through. I have a lot of problems with it, but at least for the reasons you describe, it is a coherent system. Where I would disagree is in a couple of things. First of all, in terms of the administrative costs, I think you vastly understate the costs on a public system. The direct costs you see are very low because in many cases they unload costs to other agencies. For example, insurance companies have to collect premiums. The IRS, which is not part of the health care system for Medicare, collects payroll taxes, doesn't count as an administrative cost for the Medicare system. If you actually put
But they're already doing that, so that's not going to ask, it's not the entire cost to the IRS we should add. Let me give you that and say it adds 2 or 3%. It's an additional 2 or 3% cost. So what? It's still under 5%.
Well, I think if you look at them, there's been studies. There's a great study out of the Wharton School that looks at them and says actually the public and private systems are relatively comparable, with the exception of the fact that private systems essentially have to do advertising and things like that, which I suppose you could eliminate, which would take a couple of percent.
But if that's the case, Michael Tanner, why is it that the Americans are paying on average a little over $9,000 per capita, man, woman, and children, and the next most expensive country in the world, Canada, is paying a little under $5,000, and you get down to France and Germany, which are no slouches, and they're doing just fine, thank you very much, and they're paying around $3,000.
Well, but most of that cost is not in the cost of insurance premiums. That's in the actual cost of the care we provide. And in many cases, we over-provide care. And in many cases, we simply want more care.
No, that's the cost of care as reflected by collections for insurance premiums.
What? No, it's not that the average insurance premium is a third higher. It's that if you look at a per capita cost of providing health care, we're a third higher than Switzerland and about double, say, Britain or France or Germany.
But those numbers include, in the United States, those numbers include the profits of the insurance companies.
Sure, but those profits of the insurance companies are a negligible part.
How can they be negligible if they're 30% of the overhead?
No. They're not anywhere near 30% of the overhead. And general insurance company administrative costs, which includes many things that we want insurance companies to do. For example, Medicare largely operates as an old-fashioned fee-for-service system. You send in a bill, they pay you. Doesn't matter whether the patient got well or not. Doesn't matter, on any number of how much fraud there is, which is why there's such a high fraud rate in Medicare. We want insurance companies to be doing more coordinated care, more managed care. We want them weeding out fraud and things like that. All that adds administrative costs.
Exactly, it does. And why distribute that over hundreds of companies? Why not say, okay, we're going to have one agency do this. We're going to bring best practices to that agency. We're going to we're going to have it absolutely transparent because it's part of the federal government and is subject to lawsuits, federal transparency lawsuits and things. And have it done with like every other industrialized country in the world has to a large extent.
Well, you don't have it necessarily over one company in many of these countries. In countries like the Netherlands or Switzerland, even Germany, there are a multitude of insurers.
Right, but not for profit and totally transparent and heavily regulated.
Well,
so that's what you would advocate?
More transparency.
Okay. All righty. Well, people can read Michael Tanner's work over at cato.org. Michael, thanks for dropping by. It's an interesting conversation and an ongoing one, no doubt. It's 27 minutes past the hour. Back with your calls.